Hello, I'm Doug Dickerson, State Director of AARP North Carolina. Thank you for watching. AARP North Carolina represents more than 1.1 million members in our state, so this election is very important to them on a number of issues impacting their daily lives. That's why AARP asked the two major candidates for governor to speak with us about their ideas and policies on the issues affecting our state's older adults. Attorney General Cooper, caregivers. There are 1.9 million family caregivers in North Carolina, many who are juggling work and caring for a loved one. What do you think can be done to assist with their labor of love?
One of the benefits of better health care is that people are living longer. And many seniors want to live at home as long as possible. That means that oftentimes we need caregivers in the home, whether they be members of the family or whether they be caregivers who can come into the home and help seniors. My mom and dad for several years were homebound, and I know how hard my brother and I worked to make sure we provided the quality care that they need. Both of them very much wanted to stay at home. And it's a struggle for many families to give the kind of care that they need so people can stay at home. One of the things that government should do is encourage employers to provide flex time for their employees. This can help them when they're trying to stay at home and to take care of parents. I think it's important that we have employers who will work with their employees. Now that we have many people who are still in the workforce, it's critical that these employers give this period of time to people to look after parents and to make sure that they can do work at home sometime. I believe it's also important that we expand Medicaid. Clearly, we've got hundreds of thousands of people who could be covered, and it could provide help for them at home, and it would provide an opportunity for more people to get care. One of the things that government has to understand is that more and more people want to live at home, and that we have to provide assistance to those who want to give care to people who want to live at home. And as your governor, I'll work with AARP to make sure that we help seniors who want to stay at home.
Thank you, Mr. Cooper. Governor McCrory, caregivers. There are 1.9 million family caregivers in North Carolina, many who are juggling work and caring for a loved one. What do you think can be done to assist with their labor of love?
One of my core philosophies as governor is to help those who can't help themselves, but encourage those who can. And I believe that is the conservative philosophy at heart. It is one I use to guide my decisions as governor each day and every day. In fact, my mom sadly had Alzheimer's late in her life for over 12 years. And myself and my family personally understand the struggles facing families and also caregivers as they seek to enable their family member or friend to remain active and to live the most fulfilling life possible. I also understand that caregiving often comes with great personal sacrifice, especially in terms of financial security and also support in physical and emotional health. It is the reason I fought the legislature when it came to maintaining services for Alzheimer's patients on Medicaid, and it is the reason we are now expanding Medicaid services for those living with Alzheimer's. In fact, in my budget, I requested an increase in funding for family caregiver support services through Project CARE by $1 million in this year's budget, and ultimately received a substantial increase over previous years. You know, these investments help individuals and families facing Alzheimer's, older adults, and those with disabilities who need support but want to stay in their homes. In fact, in North Carolina, we also undertook an important and bold initiative to reform our Medicaid program to improve care and also control costs for our most vulnerable citizens. Caregivers were critical stakeholders during the reform process, and I made sure that we met with and also listened to caregivers as our Medicaid Reform Group, advisory group, crafted a plan for North Carolina. I also proudly stood with the AARP when I vetoed extremely bad legislation which could be harmful to seniors living in nursing homes. The law would have actually prevented employees from blowing the whistle on workplace malfeasance in a nursing home, potentially putting seniors in bad care environments at risk. Helping those who can't help themselves has been my core philosophy of this administration and will continue to be in a second term as governor.
Thank you, Governor. Next week, we'll take a look at livable communities. I hope you will join us here on Facebook for that discussion. I'm Doug Dickerson, thanking you for your time and attention.